Thanks, Anthony. Good evening, ladies and gentlemen, and thank you for joining me tonight to go through this webinar. It is a pleasure for me to be talking about this topic. As you'll see, it is something that is really close to my heart, both personally and professionally. You'll see why. So thank you to Protexin for giving me the opportunity to talk again on this topic. So I've been given sort of 55 minutes to talk to you about FLUTD. And it is a really, really big topic, so it's been very difficult for me to kind of hone it down, but hopefully what I can give you is a highlight, sort of an overview of what I think are the important areas to consider, and hopefully you'll be able to go away from this with some very practical information, whether you're a vet managing these cases or whether you're a nurse seeing them in practice and managing them in the hospital. So, what are we going to look at? I first want to think about the relevance of this in terms of what we're seeing in practice. How common is a problem? How common a problem is FLUTD? So there was a survey performed in America which looked at all of the consultations or the reasons that cats were presented to general practitioners, and amongst that group, almost 5% of the consultations were related to FLUTD. So really quite a common reason for cats to be presented to practitioners. What worries me particularly about this spectrum of diseases is the welfare aspects, and that is both on a sort of population basis in terms of the number of cats that we're seeing affected, as well as the individual cases. So in terms of the problems that are associated with FLUTD, we see things such as inappropriate urination, and this really can be very distressing to the owners. And unfortunately, it's a not uncommon reason for cats to be relinquished back to shelters, either to be given up or to return to a shelter after rehoming. One of the problems I speak to vets about very commonly is recurrent episodes of cystitis, and particularly the male cats that are affected with recurrent urethral obstruction. And there was a paper that's been published in the journal Feline Medicine and Surgery back in 2008. And this was a Swiss group of researchers, and they looked at cats that had been presented to their clinic with urethral obstruction and looked at the prognosis and the sort of outcomes that were seen with these patients. Around a third of the cats, regardless of the underlying cause, be it urolithiasis, idiopathic cystitis, or urethral plugs, had recurrent episodes of cystitis. And the really worrying number in this paper, in the conclusion, was the number of cats that were euthanized due to recurrent episodes of cystitis, and the most common reason being a recurrent episode of urethral obstruction. Up to a fifth of the cats were euthanized due to that. And this, unfortunately, isn't something that is uncommon to us to see in our referral practice. It's often the kind of end of the line when the cats have a recurrent episode, partly because of the stress the owner's going through, not wanting to see their cat in pain and going through these episodes again, but also because of financial considerations. So, it certainly is a significant problem. What I hope is by the end of this presentation, some of the things that we'll talk through will help you to really improve the management of the cases and hopefully have a more successful outcome and try to prevent us seeing cats that have these horrible recurrent episodes of obstruction, leading to the owners being at the point of having to decide for euthanasia. So what I'm going to cover, I want to first think about what we mean by the term FLUTD and what the different causes of FLUTD are. And then really I want to focus on idiopathic cystitis. This is the most common disease that we're going to be seeing and managing in practice. And what I'm going to look at is the causes, or what we understand about the pathophysiology of idiopathic cystitis, think about what cats are predisposed, and really concentrate on the management of these cases in terms of how we manage them in the acute phase when they're in the hospital, and then what we can do in the long term to try and prevent these cats having more, or try and improve the sort of outcome, trying to reduce the severity of recurrence and reduce the chance that they will have a recurrent urethral obstruction. And we'll work through a couple of case studies to sort of show you practically how we can manage the patients. So FLUTD is an umbrella term, feline lower urinary tract disease, and we're talking about different causes or different types of diseases that affect the bladder and urethra. The bladder and the urethra can only respond to insult, be that infection, inflammation, trauma,